Some facilities for seniors, like nursing homes, are stepping up preventive measures in view of the recent rise in COVID-19 cases. Now, these are mainly aimed at limiting visitors and the wearing of masks. There were about 26,000 reported cases of COVID in Singapore from the week of the 5th of May to the 11th of May, and that is nearly double the number from the week before.
This nursing home stopped all visitation following Saturday's announcement of the rise in COVID-19 cases. But it is now easing measures. No more than 5 visitors at any one point, as daily numbers have decreased. It is increasing its supply of PPEs, or personal protective equipment, to a month in case things get worse. It may also stop all visitation again, as well as volunteer programs.
We will make sure we have staff running the activities, so we have enough number of staffs to run the whole show. Then we'll go into different teams as we have worked during the previous, the surge. So there will be different teams on a 12-hour shift taking duties on a daily basis.
This care facility for seniors is making sure visitors now need to don masks and self-declare if they are unwell. As for the seniors, things are a little more relaxed. They are only encouraged to do so. And after going out, it ensures that the seniors wash their hands and change their clothes.
We've seen how this cabin fever can really affect the seniors, both at the nursing home and the assisted living, when they are like in lockdown mode. So it does have detrimental effects on their well-being, because the inability to go out and walk and exercise really deconditions them. And sometimes I think you might keep them away from COVID, but you actually make them worse physically and mentally as well.
Some facilities for preschoolers and kids have not added measures, but preparations are in place if the situation gets worse, be it a rise in COVID-19 cases or hand-foot-mouth disease.
If the situation gets worse, right, we will step up and then we will do the sanitation more often. Instead of doing 2 times, we will do 3 times. And also doing health check. Also, we do it in the morning and also in the afternoon after the nap time. We will do it one more time. To make sure the children are safe and also well.
This kids' playground facility will make them wear socks and test for symptoms. It will turn away those who are coughing or having flu symptoms.
The new KP.1 and KP.2 variants have accounted for more than 2/3 of cases here in this latest COVID-19 wave to hit Singapore. The 2 strains belong to a new family of subvariants that scientists have nicknamed Flirt after the technical names of their mutations. And these strains actually trace back to JN1, which was responsible for the COVID-19 wave in Singapore last December. The JN1 variant is an offshoot of the Omicron variant. KP.2 appears to be spreading faster than KP.1. It was first detected in India. That was in early January, and it has since become the dominant strain in the United States, accounting for about 1 in 4 infections this month alone. KP.2 has also spread to other countries, including China, Thailand, Australia, as well as New Zealand. Medical experts say that there is some evidence that these variants may spread faster than the previous strains. But one of them says that it doesn't mean that future mutations will follow a similar trend.
I think it is quite hard to say any new strain coming up may be faster in community. Okay, we need to see what the mutations that occurred in the gene region, and we need to have experimental studies to show that, okay, these new variants may be more transmissible than the older strains.
But there are also concerns if existing vaccines work well against the latest variant. A doctor says that the efficacy of the current XBB variant vaccine against the KP.1 or 2 is around 40 to 50%. But even so, he urges high-risk individuals like the elderly and those with a weak immune system to get vaccinated.
These individuals should actually consider getting the latest vaccine, even though, it is what it is, okay? Because that's all we've got right now until the new vaccine comes about. Whatever that you get from the vaccine is at least something, because if you haven't gotten any natural infection at all, that's always going to put you at a disadvantage, particularly in regards to your immune system.